Hi, I'm Dr. David Mark. I've been with Silicon Valley Eye Physicians since the beginning, which is over 20 years ago. I'm a board-certified ophthalmologist, and I have specialty training in cornea and external disease. Now that includes things like LASIK surgery to correct nearsightedness, farsightedness, presbyopia, astigmatism, and that's worked out really well. It's a technology that has advanced itself over many years. It's gotten to the point where I feel very confident in its safety and its performance. In fact, I even did LASIK on my wife's eyes. And yes, we're still married. LASIK has undergone many upgrades since its inception about 20 years ago. Currently, we now have wavefront technology. Now, wavefront technology is a way of looking at the shape of the eye in much greater detail than we could before. So the wavefront will look at all sorts of little aberrations we call higher order aberrations in the corneal shape. Then once the treatment is performed, a lot of these aberrations are gone and your vision is better than it could have been even with glasses or contacts. There's no guarantee, of course, with any procedure, but I feel very confident that wavefront LASIK is really the state of the art. Now, I think it's important when considering a LASIK is that your surgeon is trained in cornea and corneal disease. The reason I say that is because it is a corneal procedure. Now, I perform the surgery myself. I do all the pre-operative evaluation myself, and I do all of the follow-up care as well. It's very important that the healing goes smoothly, and I think it does as long as there's very good observation and follow-up.
I'd wake up in the morning and I couldn't see anything. I'd go out for the evening and I'd have to have glasses on, and my glasses were really thick. And I thought, gosh, someday I'm gonna get my eyes done, and I mean by getting LASIK. So I heard about it, and I knew all about Dr. Mark, and I heard he was reputable, so I thought, that's what I'm gonna do. I'm gonna do LASIK. Did it. I'm just ecstatic because I can see when I get up in the morning, you know, I see my room, I see my husband, I see.
One other thing I want to say about LASIK is that it's a very rewarding procedure to perform. There's a great deal of life-changing moments that we are happy to share with our patients, to be able to go from a situation where you're very dependent on glasses and contacts for many, many years to suddenly being able to go to work the next day and drive without glasses or contacts is a very happy experience, and I'm happy to share that with my patients. Now, another area of our practice which is very important is cataract surgery. Cataracts are essentially just a clouding of the natural lens of the eye. It's not a growth, it's not a membrane, it's really just your natural lens that becomes cloudy, and then your vision becomes cloudy. It doesn't really hurt anything, but the time to fix that is when you'd like to see better. And for a lot of our patients, that can come at a younger age. For some, it's much later. However, when that time does come, it's important to figure out what's the best procedure to choose. There's a couple of choices when thinking about cataract surgery, and the latest really is what we call multifocal lens implants. So we essentially remove the cloudy lens of the eye and replace it with a new lens. Now that lens stays there forever, you don't even know it's there, and it doesn't cause any allergic reaction. It's very nice for the eye. But with the multifocal lens, you can see not only distance, but also reading without glasses, which is really liberating for most people, something they've never been able to do. And once that's performed, then you can go about your daily routine without being encumbered by glasses or contacts anymore. And when we talk about multifocal lenses, is that just for people with cataracts? Actually, no. There are a lot of younger people who are not good candidates for LASIK for one reason or another. And for those folks, we can implant a multifocal lens, which allows them to see without glasses or contacts, just as they would with LASIK, except this is even better because you have distance, reading glasses eliminated.
Hello, I'm Dr. Mendelssohn. I became an eye doctor because as a young boy I had vision difficulties. A team of doctors took care of me to ensure that I'll have a good vision for the rest of my life. At which time I decided that that's what I want to be doing when I'll grow up. And that's actually what drives me to come to work every day. I went to UC Berkeley School of Optometry, graduated about 20 plus years ago, and I enjoy coming to work every day, coaching students that come to train with me from different universities in the United States. I enjoy collaborating with my fellow colleagues, doctors here, to allow me to provide the best possible eye care needs for my patients. Silicon Valley Eye Physicians has been in existence since the mid-60s. I joined the practice in 1995 and helped build a thriving optical and optometric department. We had several additional optometrists joining us since. We have several generations of patients, parents, grandparents, and kids under our care now at this time, which is quite rewarding. We pride ourselves in comprehensive eye care. We can satisfy all eye care and vision needs under this single roof, from cataract surgery, glaucoma treatment, specialty contact lenses, treating diabetic retinopathy, taking care of retinal issues, taking care of eyelid cosmetic issues, as well as vision therapy. It's very rewarding to participate in changing lives of our patients through enhanced vision. I very much enjoy the science of orthokeratology, in which we are able to provide young adults as well as people of all ages with good vision all day long without use of glasses or contact lenses.
I have a keratoconus, so the disease progressed to the point where I needed a corneal transplant. I had a corneal transplant in my right eye in 2010. What happened is, after a transplant, it's difficult to get fitted for lenses. So Dr. Mendelsohn then recommended scleral lenses, and he and Dr. Gellis fitted me with my latest lens, which is the scleral lens. And I have to say, I'm delighted with the vision. I can see between 2015 and 2020, which is just outstanding. It's amazing. It's changed my life.
It's been very rewarding for me to take care of my patients for over 20 years. I take care of all their eyewear needs and vision needs. We are in the process of expanding the practice. We have incorporated additional services that will benefit vision needs for the practice patients. I enjoy in particular the long-term relationships that I have with my patients for many years now. I'm enjoying the fact that I can improve their life through enhanced vision, and oftentimes we have saved lives here by detecting dangerous conditions that may have led to loss of vision, and beyond that by early detection and prevention. So that's really very rewarding. We in essence sometimes not only change lives but also save lives.
Very nice.
Hi, my name is Dr. Jessley Johnson, and I'm one of the new doctors at Silicon Valley Eye Physicians. I grew up in San Jose and went to high school just up the street at St. Francis. After college at UC San Diego and optometry school at the State University of New York College of Optometry, I'm very glad to be back home in the Bay Area. Here at Silicon Valley Eye Physicians, we practice the full scope of optometry. We treat eye diseases such as glaucoma, diabetes, and macular degeneration, as well as provide glass and contact lens correction to our patients of all ages. The aspects of optometry that I enjoy the most are vision therapy and orthokeratology. Patients like orthokeratology because they get to experience clear vision free of glasses and contacts. It helps them with schoolwork as well as competitive sports. As an eye doctor, I find the stability of nearsightedness that these lenses provide to be most important. When we see patients who have had the same vision correction over a number of years, it helps me to be a strong advocate for this program. Vision therapy, on the other hand, is an area that our patients don't know too much about. Children, as well as adults who struggle with reading and learning, often have a visual component hindering their performance. This can present as poor attention span, headaches after reading, or blur and even double vision at the end of the day. Over the last few years, we've developed the Vision Enhancement Optometric Group to help our existing patients who experience these struggles. The binocular vision exam evaluates the eye teaming, focusing, and tracking systems. This information is then used to design an individualized one-on-one weekly vision therapy program. It's amazing to see students who struggle academically transform into avid readers with higher self-confidence. What I appreciate most about this practice is getting to know entire families, from kids to parents to grandparents, and addressing their different visual needs. I thank you for the opportunity to get to know you and your family.
Hi, I'm Dr. Keo. I chose to be an optometrist because it's a very rewarding and exciting profession. I thrive on making a difference in people's lives, and I get to do that every day by helping people see better and helping them maintain healthy eyes. Here at the Silicon Valley Eye Physicians, we have the latest technology, and we're able to diagnose eye diseases years earlier than we've ever been able to in the past. So I'm originally from Boston, and I moved to California to go to UC Berkeley for optometry school. I chose to go to Berkeley because I was confident they would help me become the best doctor that I could be. They have a strong academic program, unmatched clinical experience. The professors are world-renowned and leaders in their field. Of course, escaping the East Coast winters for some California sun was an added bonus. So I'm very interested in specialty contact lenses, including orthokeratology. In orthokeratology, we gently reshape the eye while a patient's sleeping by wearing hard contact lenses. When the patient wakes up, they remove the contact lenses, and throughout the day, they can maintain clear vision without having to wear contacts or glasses. We also fit scleral contact lenses, which are very advanced. We've been able to help adult patients who've never been able to see 20/20 their whole lives see clearly for the very first time. Being able to help people see better and to diagnose their eye conditions early is very satisfying. There's really no other feeling like it in the world, and I can't think of a greater profession.
Hi, I'm Dr. John Gelles. I grew up in Southern California and went to school at the Pennsylvania College of Optometry. My passion is in contact lenses. I'm currently a certified wave contact lens designer, which means that I create contact lenses that are based entirely on the measurements of your eyes. You can kind of compare it to having a custom suit made. Basically, what we do is we take the measurements of the eyes and build a contact lens that's entirely based of every point of curvature on the eyes. What this provides for the patient is superior comfort and quality of vision. We do this in not only normal RGP applications, but also for orthokeratology or CRT contact lenses. Scleral contact lenses are a newer application that I've brought into the practice. What they do is they vault the cornea to mask irregularities caused by different sorts of corneal diseases, such as keratoconus, post-LASIK ectasia, pellucid marginal degeneration, and other sorts of corneal diseases and degenerations. Specifically, patients who have severe dry eye do very well in a scleral contact lens simply because the lens vaults the cornea, providing a tear layer underneath the lens and in front of the cornea. And this keeps the cornea bathed in fluid throughout the day to increase comfort and extend our wearing time of the contact lenses. Growing up, I noticed that having clear vision was going to be a very large part of being successful in life. Whether you're successful at school, successful at sports, or successful in any other walk of life, you're using your vision almost all the time. Doing medically necessary contact lenses is a very rewarding part of my job. I gotta say, making somebody be able to see when they haven't been able to be legal to drive is quite an amazing feeling. Part of the reason why I focus on medically necessary contact lenses is to be able to provide that for the patient and give them that genuine wow factor where they go, geez, I was never able to appreciate that trees had leaves, or be able to appreciate that high definition television that they have at home. Just those little things can really improve the quality of somebody's life, and it's very rewarding to be able to provide that for individuals.